Hi friends, welcome to Nursing Jellyfish. Today let's see the important nursing MCQ for prometric, 3HS, NClex and RRB, ASIC, all competitive exam preparations. Let's see the question. First question, according to the coverage schedule, how many units you would give your patient? The nurse is caring for a diabetic child whose 11 blood glucose monitoring. That level is 269 mg per deciliter. The physician ordered the following coverage schedule. So what are the categories they are given? 150 to 200 mg means that is 2 units of human insulin, and 201 to 250 mg per deciliter means 4 units of human insulin. 251 to 300 mg per deciliter, that is 6 unit of human insulin. 301 to 350 mg per deciliter, that is 8 unit of human insulin. And 351 to 399 mg per deciliter, 10 units of human insulin. Over 400 mg, call the physician it is. So they are given the physician order for us. Okay, so what is the answer here? Option A 4 units, option B 6 units, option C 8 units, option D 10 units. Actually the categorization is 269 mg per deciliter. So what would be the correct answer? It was coming here. Yeah, 251 to 300 mg means that is 6 units. So what is the correct answer here? Yeah, it was coming from that. It is option B, 6 units will be the correct answer. That is option B will be the correct answer. Okay, move on to the next question. What is the name of the process of movement of a dissolved substance from an area of higher concentration to an area of lower concentration? The question is higher concentration to the lower concentration. But what is the material? That is solute material, dissolved substance. So option A, effusion. Option B, diffusion. Option C, emulsion. Option D, excretion it is. So what would be the correct answer? Can you guess it? That what is that it is? It is called it as diffusion. Option B will be the correct answer. Next question. A patient with colostomy, what type of stool you should suspect? Option A, with a sigmoid colostomy, the feces are formed. Option B, with a descending colostomy, the feces are semi-formed. Option C, with a transverse colostomy, the feces are unformed. Option D, with an ascending colostomy, the feces are fluid it is. So what is the correct answer here, honey? Is it that it is? Yeah, option C, with a transverse colostomy, the feces are unformed. So option C will be the correct answer. Next question. A client is being prepared for a thoracosynthesis. A nurse assists the client to which position for the procedure? Option A, lying in a bed with the affected side. Option B, lying in a bed and unaffected side. Option C, Sims position with the head of the bed, it is flat. Option D, prone with head turned to the side and unsupported by a pillow it is. So what is that? It question is it? The patient is preparing for thoracosynthesis it is. So what could be the correct answer? Can you guess it that? Yeah, what is that? Option B, lying in bed on the unaffected side will be the correct answer. Next question. A nurse is preparing to insert a nasogastric tube into a client. The nurse places the client in which position for insertion? Option A, right side. Option B, low Fowler's. Option C, high Fowler's. Option D, supine with the head flat it is. Usually which is comfortable position for the nasogastric tube insertion? That is high Fowler's position it is. So option C will be the correct answer. Next question. A nurse develop a plan of care for a client with deep vein thrombosis. Which client position or activity in the plan will be included? Option A, out of bed activities as desired. Option B, bed rest with the affected extremity kept flat. Option C, bed rest with elevation of the affected extremity. Option D, bed rest with the affected extremity in dependent position it is. So what is the correct answer here? Yeah, what should you do for that? Bed rest with elevation of the affected extremity. So option C will be the correct answer. Next question. A client in labor is transported to the delivery room and it is prepared for a cesarean delivery. The client is transferred to the delivery room table and the nurse places the client in the option A trundle position with the legs in stria. Option B semi-Paulus position with a pillow under the knees. Option C prone position with the legs separated and elevated. Option D supine position with the wedge under the right hip it is. So what is the position you have to prepare for the client in labor room it is? Trundle position, semi-folders or maybe prone or maybe the supine. Prone is not advisable and also Trundlenberg. So what should be it is? Supine position with a wedge under the right hip will be the correct answer. So option D will be the correct answer. Move on to the next question. The nurse is caring for a client who is first day post-operative for a total hip replacement. Which is the best position in which the nurse should place the client? Option A, side lying on the operative side. Option B, on the non-operative side with the leg abducted. Option C, side lying with the affected leg internally rotated. Option D, side lying with the affected leg externally rotated it is. So what could be the correct answer it is? Can you consider that? Yeah, what you have to do for that it is? For the first post-operative day total hip replacement. So the correct answer is option B on the non-operative side with the leg abducted it is. So that will be the correct answer. Next question. Which of the following is the best position to increase the brain perfusion? That is cerebral perfusion. Option A prone. Option B semi-fowler. Option C supine. Option D Trendelenburg position it is. So what could be the correct answer here? Yeah, everyone knows it is. So if you are doing the Trendelenburg position, that will be increase the brain blood circulation it is. So option D will be the correct answer. Okay, move on to the next question. Your nurse is administering a cleansing enema to a client with a fecal impaction. Before administering the enema, the nurse places the client in which position it is? Option A, left Sims position. Option B, right Sims position. Option C, on the left side of the body with the head of the bed elevated 45 degree. Option D, on the right side of the body with the head of the bed elevated 45 degree. So everyone knows it is. What is that it is? So when you are going to give the enema for the patients, so what is the position we are going to use? That is left sim position it is. So that is why option A will be the correct answer. Move on to the next question. A client has just returned to a nursing unit after an above knee amputation of a right leg. A nurse places the client in which position it is? Option A prone. Option B reverse Trendelenburg. Option C supine with amputated limb flat on the bed it is. Option D supine with the amputated limb supported with the pillows it is. Actually the position what is that you have to maintain for the knee amputated patient it is. So what is the correct answer? So whenever it is amputated, so what you have to do? You have to support it with the pillows. So that is why option D, supine with the amputated limbs supported with the pillows. So option D will be the correct answer here. Next question. A nurse is caring for a client with the severe burn who is scheduled for an autograph to be placed on the lower extremity. The nurse develop a post-operative plan of care for the client and include which of the following in the plan? Option A, maintain the client in prone position. Option B, elevate and immobilize the grafted extremity. Option C, maintain the surgical extremity in a flat position. Option D, keep the surgical extremity covered with the blanket it is. Actually, what is the question here? Severe burns patient, it is autograph patient, that is in the lower extremity. So that is why what is the post-operative plan of care it is. So what you have to do for that? Shall I do the prone position? No. Shall I do the surgical flat position? That is also. So keep the surgical extremity covered with the blanket should not do for it. So what you have to do for that? Elevate and immobilize the grafted extremity, because it will make a grafting will be demobilized, that will be damaged. So automatically repair was again we have to do, and also fluid accumulations also will be there. So that is why you must do what is that? It is elevate and immobilize the grafted extremity will be the correct answer for this question. It is. Next question. A nurse is preparing for a patient client with who has returned to a nursing unit following a cardiac catheterization performed through the femoral artery. The nurse checked the physician prescription and a plan to allow which client position or activity of the following procedure it is. Option A, bed rest in high Fowler's position. Option B, bed rest with bathroom privileges only. Option C, bed rest with head elevation at 60 degree. Option D, bed rest with head elevation no greater than 30 degree. Actually, what is the condition of the patient? The client returned to the nursing unit with cardiac catheterization performed through the femoral artery. So if it is cardiac catheterization will be there, automatically blood circulation is going to be impaired. So that is why what you have to prefer further should not go up to Paulus more than that. So that is why bed rest with head elevation no greater than 30 degrees. So option D will be the correct answer. Next question. After the client undergoes a total hip replacement, how should the nurse position the affected hip? Option A, adduct the hip. Option B, flex the hip. Option C, abduct the hip. Option D, extend the hip it is. Actually, patient undergone what is the condition it is? Yeah, total hip replacement. So what could be the correct answer here? Option C, abduct the hip. That will be the correct answer for this question it is. Move on to the next question. A client has an open reduction and internal fixation for a fractured hip. Post-operatively, nurse should position the client affected extremity in option A, external rotation, option B, slight hip flexion, option C, moderate abduction, option D, anatomical body alignment it is. So what could be the correct answer here? Can you say that what you do for the affected extremity it is? So you should do the moderate abduction. The option C will be the correct answer. Next question. Which of the following position should the nurse place a client for rectal tube insertion? Option A, left lateral position with hyperextension of right knee. Option B, left lateral position with hyperflexion of left knee. Option C, left lateral position with hyperflexion of right knee. Option D, left lateral position with hyperextension of left knee it is. Actually, what is the position you have to maintain for rectal tube insertion? So when the patient was lying down in the left lateral position only, the rectus we can able to be insert the tube. So that is why you have to lie down in the left lateral position with hyperflexion of right knee we have to do for it. So that is why option C will be the correct answer. Next question. If you like this video, please like and subscribe channel, and also follow on the Telegram channel and WhatsApp channel, and also Nurse Genius app available for all the questions it is. Which of the following position inappropriate for the patient to use for self-administration of fleet enema it is? Actually going to administer self. So option A, left lateral position, right leg flexitus. Option B, face down and leg flexitus. Option C, face upward and leg free on back and flex hip and knee it is. So option D, chest knee position it is. Actually, what is the question here? Can you guess it? What is that it is? That is appropriate for the patient to use self-administration of fleet enema. That is, enema is going to administer by themselves it is. So what is the correct answer? That is face upward and leg free. That is on back and flex hip and knee will be. That is option C will be the correct answer here. Next question. The best position for your child with myelomeningocele is option A, prone, option B, supine position, Option C, semi-follower's position. Option D, modified Trendelenburg position it is. So usually myelomeningeal means it is in the back of the neck. If the patient can able to lie down in the supine position or a semi-follower's, it's not possible. Only the comfortable position for the baby is only it is prone position. That is why option A will be the correct answer. Next question. Unless the physician order otherwise, in which position should the nurse place the infant during the postoperative period of surgical repair of myelomeningocele? Option A, supine. Option B, prone. Option C, right or left side lying. Option D, whichever position is most comfortable for the infant. So what we have to do for this? The condition of the baby is myelomeningocele. So you should know that if the baby is on myelomeningocele, whatever it is before or after, whatever it is, you must be like the position in the only prone position should be for the baby it is comfortable. So that is why option B will be the correct answer. Next question. The nurse is caring for a client with on above the knee amputation, that is aka to prevent contracture, the nurse should option A, place the client in a prone position 15 to 30 minutes twice a day. Option B, keep the foot of the bed elevated on soft block. Option C, place trochanter roll on either side of the affected side. Option D, keep the client leg elevated on two pillows it is. So what is the correct answer here? Can you say that? Yeah, patient is on above knee amputation it is. So what should do that? Yeah, we have to place the client in prone position 15 to 30 minutes twice a day. So that is why it is prevent the contraction of the person it is. So that is why option A will be the correct answer. Next question. Postoperative nursing care of the infant following surgical repair of a cleft lip would include option A, feeding the infant with the spoon to avoid sucking. Option B, position the infant on the abdomen to facilitate drainage. Option C, applying elbow restraint to protect the surgical area. Option D, providing minimal stimulation to prevent injury to the incision. What do you have to do for the post-operative nursing care of the client with the surgical repair of cleft lip? The correct answer is applying elbow restraint to protect the surgical area. So option C will be the correct answer. The client has returned to the nursing unit following a right below the knee amputation. Right below knee amputation. How should the nurse position the client it is? Option A, supine with head turned to the side. Option B, with shock block placed under the foot of the bed. Option C, semi-sitting position with knee bent. Option D, left lateral with pillows between the knees it is. So what is the correct answer for below knee amputation in the right side leg it is? So what do you have to do for that it is? What is the correct answer here? Yeah, you should do the shock block placed under the foot of the bed. That means what is that? Option B will be the correct answer. Next question. What position should the nurse place the head of the bed to obtain the most accurate reading for jugular vein distension? So option A, high Fowler's. Option B, raised 10 degree. Option C, raised 30 degree. Option D, supine position. So what you have to do for assess the jugular vein distension it is? What is the correct answer here? So that will be raised 30 degree. Option C will be the correct answer. Move on to the next question. Which of the following body position is best for a patient with increased ICP? Option A, prone. Option B, Trendelenburg. Option C, head of the bed elevated 90 degree and keep flexed. And option D, head of the bed elevated 20 degree. So how we are going to do the ICP for the patient it is? So which is comfortable it is? Yeah, head of the bed elevated 20 degree. Option D will be the correct answer. Next question. Immediately after a percutaneous liver biopsy, the nurse should place the client in which of the following position? Option A, left side lying. Option B, right side lying. Option C, lithotomy. Option D, trundle lumbar position, which is comfortable for that. So which one it is? If the patient was on liver biopsy, that is option B, right side lying position will be comfortable position for the patient it is. Next question, an adult has low back pain. Which position is likely to be most comfortable for the client it is? Option A, prone. Option B, supine. Option C, side lying with knee flexed. Option D, semi-sitting with legs extended. Yeah, now you tell me what is the correct position for the patient it is. So what is that? Side lying with knee flexed. The option C will be the correct answer for back pain patient it is. Next question. Which is the least desirable position in which the nurse can place the client it is when planning the client post-operative care? Option A, lying prone position. Option B, lying supine. Option C, sitting in a chair. Option D, standing to shower it is. So what is the correct position we have to do for the patient it is? Yeah. What is the correct answer here? Option C, sitting in a chair. That will be the correct answer. Next question. For a patient who is suffering from acute asthma attacks, which of the following is the appropriate position it is? Option A, right lateral. Option B, supine. Option C, high fowler. Option D, prone position. So which is comfortable for the asthma patient it is? Yeah, which one it is? High fowlers. So the option B will be the correct answer because the fowler is easy to be breathed. Lung will be expanded more it is. Next question. A patient with COPD is admitted to the how can the nurse best position the patient to improve the gas exchange it is. Option A, sitting up at the bedside in a chair and leaning slightly forwarded. Option B, resting in bed with the head elevated to the 45 to 60 degree. Option C, in the trundle position with the several pillows behind the head. Option D, resting in a bed in a high fowler's position with the knees flexed. So what is the correct answer? The patient with COPD. So the patient with what is the correct position we have to do? Sitting up at the bedside in a chair and leaning what is that? Slightly forward. So that is why option A will be the correct answer. After undergoing a thyroidectomy, a client developed hypocalcemia and tetany. So, which electrolyte imbalance should the nurse anticipate for administering? Option A, sodium phosphorus. Option B, sodium bicarbonate. Option C, calcium gluconate. Option D, potassium chloride. So, what could be the correct answer? When the hypocalcemia is coming, that is related to the tetanitis. That is related to calcium deficiency. So whenever the calcium is going to decrease, so you will be getting. So what is the correct answer? What you have to administer? Yeah, calcium gluconate. So that is why option C will be the correct answer. I think you have understand all the question and answer. If you have any doubt, you can ask. And also it is available in Nurse Genius app. All the questions paper for prometric, nclex and everything. Thank you for watching. All the best for your exam. It's Dilfish Meena.